I'm Dr. Lawball from Back to Health. Come hang out with me in this video because we're talking about inversion table therapy. You know, it never seems to fail. Whenever I'm out in public and I meet somebody for the first time and they find out I'm a chiropractor, one of the first questions they ask me is, hey, what do you think about those inversion tables? Do they really work? And I'll start off by saying this. I like inversion table therapy. I own a table. I use a table. However, I'll also say this. I do think in the television commercials where they're selling these tables that they tend to overstate the benefits. Inversion table therapy is not a panacea. It's not something that if you do that just by itself, it'll cure all of your back pain. But I do think it's one piece of the puzzle in developing a strategy to really try to get your back in shape and rehabilitate your spine. But before we get into looking at the inversion table, let's talk about a couple of precautions that we should take. First and foremost, there are a couple of health conditions that should make you reconsider whether or not you want to do inversion table therapy. Particularly if you have heart disease or vascular disease, you may be disqualified from doing inversion table therapy. Flipping yourself upside down puts additional stress on your heart, and it also increases your blood pressure. So if you suffer with uncontrolled high blood pressure, you've had a previous stroke, or you've had an aneurysm, I wouldn't be doing inversion table therapy. Another person that should consider avoiding inversion table therapy would be somebody that deals with positional vertigo, and you know who you are. If you're prone to turning your head and getting dizzy, definitely consider flipping yourself upside down. The final thing that I would pay attention to is if you suffer with glaucoma or retinal detachment. Again, we're upside down, increased pressure in the head, increased pressure in the eyes. I wouldn't be doing inversion therapy. All right, let's take a look at the table that we have here at my home. All these tables are somewhat similar, but they'll have some small differences to them. Let's review some of the features. One of the features you'll find in these tables is that they have the ability to collapse down for storage. Make sure when the legs are open though, there's usually a locking pin here. So make sure you have that locking pin engaged, very important. Conceptually, the next thing to know about the tables is that they are adjustable to height. So in order to make the table work properly, the height has to be set to the user. So if you have a height discrepancy between users, let's say one user in the home is 6'1" and the other is 5'10", you have to adjust the table to the height to make it work properly. So the height adjustment on this table is located right here. The next feature, very important to understand, is the ankle locking mechanism. Certainly one of the more dangerous aspects of these tables is inverting and having your ankles coming unlocked and coming back on top of your head. So understand thoroughly how to utilize your ankle locking mechanism. The final thing is some type of mechanism to set the amount of inversion. This table uses a pin lock mechanism here. Some tables will use like a strap mechanism, but regardless of how your table does it, make sure you understand how to set the amount of inversion. And what that does is it allows the table to come back to a set amount of inversion off horizontal, and then it stops there. So right now this table's set for 30 degrees. Now, understanding the degrees of inversion, really you're going to get your benefit at about 20 to 30 degrees off of horizontal. That's where the benefits start. One of the most biggest problems I see with these tables is patients overdoing it, where they buy the table, they're very excited about it, they dive on the table the first day, they go 90 degrees upside down, and they hang there for 20 to 30 minutes, and that's where they get problems in there. So I would encourage you to ease yourself into this table, and the way that I would recommend doing it is starting off at about 2 to 3 minutes at about 15 to 30 degrees off of horizontal, and just coming up off the table and seeing how you do the rest of the day, kind of assess yourself. The next day, add a minute or two at 20 to 30 degrees. The next day, add a few more minutes. But basically, work yourself up to where you're doing like 5 to 10 minutes at a relatively light angle of 15 to 30 degrees and assess how your body responds to it. Now, once you get to that point where you're on the table for like 10 minutes or so, at a relatively light angle, you can add on another minute or two of a steeper angle. So you could go from like 10 minutes of 30 degrees and add on like 2 minutes of 45 degrees, and then come up and assess. And really over a period of weeks, slowly work yourself into becoming tolerable to higher degrees of inversion. Speaking of degrees of inversion and doing the highest amount, I really recommend going back about at most 60 degrees off a horizontal. Once you start getting past 60 degrees of horizontal, and I know there's YouTube videos out there that show patients how to hang completely upside down and get all that benefit, I do think the risks though start to increase beyond 60 degrees, and you're gonna get plenty of benefit at 60 degrees. So anything between 30 and 60 degrees for 10 to 15 or maybe 20 minutes a day, I think is that sweet spot to get a lot of the good benefit from inversion therapy, but also mitigating some of the downside risks. Speaking of safety first, one of the other things to pay attention to is I don't recommend doing inversion table therapy when you're home alone. So certainly try to have somebody at home with you when you're upside down. And if you don't have the ability to have somebody home alone with you, at least have your cell phone on you. And when I say that, I mean literally like on you, because when you invert upside down, your phone can go flying. So make sure your cell phone's attached to you, but definitely try to have somebody around or somebody accessible should something go wrong. Some important questions that I get, one of those is, which table should I get? And what I would say is, I don't think you need to purchase the table with all the bells and whistles. I think an entry-level table is what, is going to be fine for 99% of our clientele base. I think the big thing to pay attention to on these tables is the weight rating on them. If that's a concern for you, make sure that you're checking to that the table can hold your weight. I wouldn't hold you back from getting all the bells and whistles, but really it's not that complicated. We just need something to invert ourselves off a horizontal. On that note, I would say that a great place to pick these tables up are on like secondhand for sale websites. Even friends and family. These tables tend to be something that people will buy and not necessarily use. They have great intentions of using them, but they just don't end up using them, kind of like a piece of exercise equipment. So perhaps speaking with friends and family, they give you a good deal on one, or you can pick one up on a secondhand site. Another question that I get is, when is the best time to use this table? And everybody's a little bit different, but I would say most people get their benefit utilizing this table at the end of a workday. Certainly gravity's been compressing down on you all day. Hopping on the table for 10 to 20 minutes after a long, hard day certainly kind of stretches the spine, takes the pressure off the joints, and offers that relief. Hopefully you found this video about inversion tables interesting and insightful. If you have any other additional questions, don't hesitate to ask us at your next appointment, or you can reach out via email, and we'll do everything we can to answer your questions and help you guys get back to health.